Acumen Hypotension Prediction Index software setup and use on the HemoSphere Advanced Monitor. The Acumen Hypotension Prediction Index, or HPI software, detects hemodynamic instability associated with hypotensive events. A hypotensive event is defined as a mean arterial pressure of less than 65 millimeters of mercury lasting for at least 1 minute. The HPI secondary screen, a feature of HPI, provides additional parameters which can be used to quickly review patient hemodynamics related to hypotension. Smart alerts, smart trends, and the parameters on the HPI secondary screen can further assist clinicians in identifying and, if necessary, treating underlying hemodynamic factors that may be contributing to a patient's impending instability. HPI software is available on both minimally and non-invasive Edwards Lifesciences technologies. In this video, we will demonstrate the connection and setup for the minimally invasive Acumen IQ sensor and the non-invasive Acumen IQ cuff. Minimally invasive technology setup, Acumen IQ sensor. Setup of the Acumen HPI software for minimally invasive use requires an Acumen IQ sensor, a HemoSphere pressure cable, and the HemoSphere Advanced Monitor. To begin, turn on the monitor and enter the patient's demographics. When finished, select Minimally Invasive Technology, then select Proceed to Setup. Mount the Acumen IQ sensor on an IV pole using an appropriate holder, such as the True Clip holder, and ensure tubing is primed according to hospital policy. Plug the red connector from the AIQ sensor into the cable, which connects to the bedside monitor. Then connect the green connector from the AIQ sensor to the HemoSphere pressure cable. Connect the free end of the HemoSphere pressure cable to either one of the smart ports on the side of the HemoSphere Advanced Monitor. To zero the Acumen IQ sensor, turn the stopcock off to the patient. Remove the non-vented cap. From the zeroing screen, touch the zero icon. Additional methods for zeroing the sensors are provided in the operator's manual. You may also zero the bedside monitor per hospital policy. Once zeroing is complete, replace the non-vented cap and turn the stopcock back on to the patient. The sensor is now actively in use. Non-invasive technology setup, Acumen IQ cuff. Setup of the Acumen HPI software for non-invasive use requires an Acumen IQ cuff, a reusable pressure controller and heart reference sensor, or HRS, and the HemoSphere Advanced Monitor with the ClearSight module in place. To begin, turn on the monitor and enter the patient's demographics. When finished, select Non-Invasive Technology, then select Proceed to Setup. Connect the reusable pressure controller to the HemoSphere ClearSight module. Then, wrap the pressure controller band around the patient's wrist and attach the pressure controller to the band with preference to the non-dominant arm. Use the finger cuff sizing aid by wrapping it around the middle phalanx of the index, middle, or ring finger of the patient, and pull the smaller end of the color-coded aid through the slot until snug. Do not apply the finger cuff on the thumb, small finger, or any previously fractured fingers, as this may impact accuracy. Gently open the finger cuff and place it on the middle phalanx of the sized finger. Align the patient's finger between the two green lines and center the cuff between the second and third knuckles. Align the distal end of the finger with the center line of the alignment tab. Allow the finger cuff to close around the finger, ensuring it remains aligned and does not rotate. Remove the adhesive backing and secure the cuff around the finger. Remove the adhesive backing from the distal end of the alignment tab and secure to the top of the finger cuff. Lead the finger cuff cable between two fingers and to the back side of the hand. Plug the finger cuff connector into the pressure controller. Refer to the pressure controller instructions for use for more details. Connect the heart reference sensor to the pressure controller. Vertically align both ends of the HRS and touch the 0 button on the screen. Attach the hard end of the HRS to the patient at the phlebostatic level with an HRS clip. Attach the other end of the HRS to the finger cuff. Touch the Start Monitoring icon on the navigation bar or on the Setup Help screen to begin monitoring. This completes the non-invasive setup procedure. Understanding the HPI parameter. The Acumen HPI algorithm indicates the likelihood of a hypotensive event on a scale from 0 to 100, with higher values indicating a higher likelihood of a hypotensive event. The HPI value is updated every 20 seconds. By default, the HPI value is displayed on the information bar. To select HPI as a key parameter, touch the desired tile and then select HPI under the Select Parameter tab. HPI Smart Alerts and the HPI Secondary Screen. HPI Smart Alerts highlights components of physiology, preload, afterload, and contractility, which may aid in targeting clinical interventions for potential underlying mechanisms of a hypotensive event. When the HPI value exceeds 85 for 2 consecutive 20-second intervals, the HPI High Alert pop-up appears recommending a review of the patient's hemodynamics. To acknowledge the pop-up without reviewing additional hemodynamic parameters, touch the Cancel icon. Select Review Smart Trends button to access the HPI secondary screen, which displays additional parameters that may further inform clinical decisions. The HPI secondary screen can also be accessed by touching the HPI information bar indicator button, touching the HPI key parameter shortcut icon on the main parameter tile, or by accessing the Settings menu, selecting the Clinical Tools tab, and then touching the HPI secondary screen icon. The default view for the HPI secondary screen is the Smart Trends view. Within this screen, parameters linked to each physiological category are displayed. Highlighted parameters identify physiological categories for potential intervention in preventing or treating hypotension. Clinicians can change the linked parameters and customize factors that determine which categories are triggered. To adjust the Smart Alert threshold values, open the Settings menu by touching the Settings icon in the upper right-hand corner of the HPI secondary screen. Percent change threshold is the percent change at which the parameter will be flagged. Percent change time interval is the time frame in minutes for which the percent change threshold is evaluated for each displayed parameter. The parameter selections determine which parameter is tracked for each physiological mechanism. Only the selected parameters will be subject to the alarm thresholds entered. By default, SVV, CI, and SVR are the selected parameters. To disable the Smart Alert feature, uncheck the Smart Alert box, and to stop showing HPI and mute HPI alerts, uncheck the Always Display HPI box. Touch OK when finished. In addition to the Smart Alerts view, the HPI secondary screen can be viewed in Relationship view. Toggle between these views by touching the icon for the desired view at the top of the screen. The Relationship view shows parameters arranged visually based on their correlation to physiological categories by preload, afterload, and contractility. The displayed trend graph parameter value scales can be adjusted within the Settings menu. Touch any parameter graph to view a larger graphical trend plot. The selected parameter graphical trend plot will appear in place of the blood pressure waveform plot. Note that the graphical trend plot has a 30-second timeout. Using either Edwards Lifesciences minimally invasive Acumen IQ sensor or non-invasive Acumen IQ cuff, clinicians can access the power of predictive decision support while monitoring their patients' hemodynamics.